So good afternoon or good day, depending where you are in the world. Welcome to this special webinar of the Ukraine Health Connector. As you know, we have been, with many of you who are on this call, been looking at how we can help Ukraine during this situation. We're very fortunate to have with us today our guest from Kyiv in Ukraine to tell us from personal experience and on the ground experience as to what's going on. We also have an opportunity for a question and answer session during this. So after the minister speaks, I'd be grateful during that time if you could insert your questions into the Q&A. I will do my best to get through all of them and to put as many of them as possible to the minister who's agreed to answer them. We will not be able to answer detailed medical questions because the minister has pointed out he's not a doctor, and that's neither am I. But we can remember today is about listening and about looking at humanitarian and healthcare needs that Ukraine have listed down. And there will be links in the chat shortly for you all to look at those. The key here is that we all want to help. We have to figure out how to help. And today you will find a way of able to be directly helping. So please fill in the Q&A while we speak. And I'm now delighted, absolutely delighted and honored to have with us. And he's agreed to let me attempt to pronounce his surname. So it is a great welcome to Minister Oleksii Iaremenko. Please, the floor is yours, Oleksii.
Thank you. Dear colleagues, it's a great honor for me to be here today and speak on behalf of the Ministry of Health of Ukraine. Nowadays, we are all witnesses of unprecedented cruelty of Russia's aggression and their uncovered attempt to demolish Ukrainian people. There can be no doubt that Russia must bear responsibility for this genocide. There are no Ukrainians left who are avoided to effect this war. We all have relatives, friends who were killed or injured, missing or escaping rescue their kids. My daughter is 9 years and she and herself are first refugee. After witnesses the rocket attack and after a continual air raid alerts, she started having panic attacks. She had to leave because nowadays we have no place in Ukraine secure from the threat of the bombing. But I consider myself to be very lucky that, indeed, because my daughter is at a safe place and unlike tens of thousands of other Ukrainian children who remain blocked in bomb shelters with lack of food, clean water and medicine and no chance to escape from the occupied cities, because Russians just don't let them go. As of today, we have 217 children killed and 391 injured as a result of war. It's unbelievable, and it's a terrifying statistic. It's growing every day. Ukrainian mother give birth to kids in bomb shelter and have to write on the bodies of their kids the names, date of birth, and contacts details of their relatives to ensure that the kid will be cared if mom dies. And it's our reality. None of us could have imagined it. It is all the result of Russia's aggression, and Russia believes that the crimes against humanity will remain unpunished. Russian terrorists are shooting ambulances on the road and capture its vitally important medical transport. It's already at least 78 ambulances were destroyed and 106 captured. Russia's aggressions continue destroying civil infrastructure, including hospitals, with the rockets, refusing doctors access to injured. It's already 351 healthcare facilities were damaged and 39 completely destroyed. We are extremely proud of our medics, doctors, who are overcoming the deathful danger and keep fighting for each and every life. They are true heroes on a duty. And we believe that it's the only way the world should act, to do everything possible to save lives. Despite significant losses, the health system of Ukraine has shown it's still in a good capacity. It is noted by all foreign doctors who have joined us. Saving life now is priority for Ministry of Health. That's why we, from the first days, we are focused on trauma and surgery. We lost medical infrastructure, including delivery and of medicine. So Ministry of Health prepared standard list of medicine and medical equipment that are required as a humanitarian support. And this list are shared with all our international partners as one key stream. Across the needs of medicine, it's analgesic, antibiotics, anesthetics, external fixation systems, tourniquets, first aid kits, and other. Among equipment, it's patient monitor, mobile X-ray machine, ultrasound, vacuum device for wound therapy. Ministry of Health monitoring with electronic instruments needs from the hospitals. It's continues basically daily. Based on this data, we are making of dissemination humanitarian support to the specific hospital and specific region. Of course, we are focusing on the regions where the occupied or under attack regions. Besides the horrors of war, we also see the huge support from all over the world. We thank our partners, volunteers organization, and people all over the world who are a huge force and huge support to us these days. We are grateful to the international doctors who are who are contributing to fight for lives here in Ukraine and abroad. We appreciate every effort made by our international partners who are helping us save lives. In the first weeks of war, we received significant humanitarian aid. Unfortunately, for the last 2 weeks, we see a slightly decrease of medicine as humanitarian aid. And just want to remind that the war is still going and we need your support. We appreciate every help because we dramatically need it in any possible ways. And we are welcoming new partners to join this global movement to stand and act with Ukraine. Thank you very much.
Thank you very much indeed for that, Minister. We have some questions coming in. I'll put some of them to you in just a moment. But it is important that, I don't know whether we've managed to put up in the chat yet, Heather, the particular list of humanitarian aid. There were 8 pages, if I remember, from the Minister. That can be put in the chat. Relevant to that, one of the key questions that has been come in from Flaviana in Bucharest is that I see that document is on the chat now. If anyone wants to look through it, please. Flaviana's question was, she has been assisting within Romania in making sure equipment and so on could come to Ukraine, and she's continuing those efforts. So we're grateful to you, Flaviana, of course, for that. She is a bit concerned, though, that when she was doing this, she wants to be sure that some of the messages are actually from your Ministry of Health. She received an email recently saying, giving her various questions, and she just wants to be certain that it's you, because I'm sure you get quite a lot of this, of other people perhaps posing as you and the ministry. Would it be, I don't want to put more work on you, but I see in your humanitarian list, which you've given us, that there are telephone numbers and official email addresses in those documents. Is that the answer? Should we encourage people to avoid others who may be trying to mislead them? Minister, what do you think?
In the letter with humanitarian requests, you see basically my contact and contact of Alexandra Kozlovska. She is director of International Directorate, Ministry of Health. Basically, we are responsible for humanitarian support and communication with international partners. Understand that in this contacts added not official emails, we have official ones, but with current situation when our internet goes down quite regularly and with attack to our electronic system from Russia Federation, we decided to use Gmails. But again, you always can confirm from my side or from Alexandra and ask, please send from official mail. As we got access to it, we always can provide this. So please verify. It's very important in current times. I always verify all requests quite often. So
I can imagine. Flaviana, we know each other well. I hope that has been useful. Andy will be happy to supply you, if you haven't got it, with any the contact details that the ministers just mentioned. These are direct details. I often WhatsApp them, I'm afraid, usually at weekends, it seems. But you know, do use those email addresses and contact details we have in the chat. And thank you for the work you're doing, and please do continue it. Minister, I have another question here. I'm just reading it as I speak. Here we go. Pharmacists across Europe are just about to launch a centralized fundraising scheme as part of an initiative, the European Pharmacy Association. So I just wanted to inform you of that, Minister, and of course they can.
Sorry, I lost connection for a couple of minutes.
Okay, sorry.
For 1 minute. So
yeah, not to worry. So it's just, I'm just going through these questions. There's quite a lot coming in. There's one particular just statement from Mark, who says pharmacists across Europe are about to launch a centralized fundraising scheme as part of a European Pharmacy Association initiative, EU initiative. So again, if they could keep you informed of that, so you can help direct them, I guess, Minister, is the best route for that.
Yeah, it will. Yeah, please.
So Mark, if you're still there, if you could please take that opportunity to connect with the Minister direct. The next one I've got is.
And in this regard, I just want to comment.
Sure.
I believe most of you who are watching us receive requests on medicine from some regions or some hospitals, and I want to ask you, please verify with the Ministry of Health. It's very important because we want to avoid duplications. That's why we are tracking needs on the ground through the electronic system. I know sometimes some people can ask not for like critical issue. Yeah, we want to focus on that's on a medicine that are very critical for Ukraine and not spread resources on other things.
Okay, thank you. So we still have many more questions coming in. I'll do my best to get through all of them, and I'll try to group some of them together because some of them raise the same points. Here we are. A question from Adam. How can we be sure that our contribution of medicines and supplies are aligned with your needs to the national and local levels? I think probably part of the answer to that would be that the Minister has already published, and we have put in the chat, the list of medicines and things required at the moment. So I think if you respond to that list, at least that would direct them. Would that be a reasonable answer, Minister? Are you happy with that?
Yeah, that's exactly. And we are updating this list. For the last 2 months, we updated it 4 times.
Okay.
So I guess once or twice per month, we are definitely updated. So please use most updated. Last one is 15th of April.
Yes, I think that's the one we're possibly is the one we're using. But obviously the minister will continue to supply those, and we will continue to publish those on our Ukraine Health Connector for your information. Just writing in here now. Yes, here's another one. This is from Neil in the US at the American College of Cardiology. His question is it helpful to activate telehealth networks with specialists like cardiologists to assist hospitals in Ukraine with remote consultations? If yes, would it be most helpful if those doctors that are providing consultations speak Ukrainian? Because I know, Neil, you and the American College of Cardiology have actually translated some of your communications into Ukraine already. So in that case, Minister, can you respond to that? Or we should simply ask the American College to connect with you directly?
Yes, my proposition, yeah, it sounds good. We need to discuss details. Yes, please write me a mail and we'll discuss.
So Neil, I know you're listening, so if you could do that, that would be really helpful. And the next one I've got is that, here we go. Yes, again, another question from Mark again. He is organizing medicines2ukraine.com, and he's grateful for some visible written support from the Ukrainian ministry. By that, Mark, I know we're not talking to you at the moment, we have to do Q&A, but I'm assuming what you mean is you want to be sure people to understand that what you're doing is officially endorsed, so to speak, by the ministry. So on the basis that I've interpreted that correctly, again, I suggest, if I may, Minister, you'll get a lot of emails after this, I'm afraid. If people could contact you direct, and Mark, if you could contact the minister directly, tell him what you're doing, tell him what you need, he will tell you whether he's able to assist. So if that's okay with you, Minister, we'll...
Yes, great.
Okay, we'll take another question. There's 30 odd questions already. Here we go. Yeah, there's one in particular, which is from Veronica Papa. For people with disability or rare diseases that need evacuation from Ukraine, who do they need to contact within the Ukrainian Ministry of Health in order to start the process?
Yeah, we, with our European partners, established evacuation corridor. It's clear procedure how and where people should be evacuated. European countries opened for us 10,000 beds, and the decision about evacuation should conducted with doctors and regional administration. Then the list of patients go to the Ministry of Health. It entering into European system, and we organize a transfer to the Polish border where the people are evacuated to the specific clinic. So the procedure is quite clear. You can contact me, and I will, if you have a detailed information, and we'll decide with, I guess, specific person or something.
Yes, brilliant. Thank you very much indeed. The next one is I'll just read the message. It's from Brett. It's called a UK-based Ukrainian doctor is purchasing equipment, including ambulances, to assist and is raising more funds. The question is she at risk if we publicize her efforts to seek support? It's hard to answer the question, I'm assuming.
It's hard to answer because I need to know more detail. Is it risky or not? It's very dependent where she lives and the information.
Yes.
But please avoid, in any cases, please avoid publish specific address of Ukrainian hospitals, because we had some cases when Russia attacks. It was announced that hospital received support, and this hospital was destroyed the next day. We saw the specific attack on hospitals. It's horrible. So please avoid in your communication to make specific address.
Thank you. That's really helpful advice and obviously important. So again, on that one, the person who's asked that question, please take the minister's advice, but also connect with the minister and his team to get specific advice, which is more private advice. The next one is from John Warner in the US. It says, can you list the greatest medical needs beyond professional healthcare people? What particular equipment like ambulances, stretchers, or wheelchairs, medical supplies? I think, John, if I could help answer that question, if you look in the chat and look at that, the 8 pages, it goes some way towards answering some of the questions you have raised. I know you're very keen to understand and help Ukraine. So I'm hoping that that chat list will assist you. If not, please contact either us directly or contact the Minister. Because as you say, Minister, you're going to keep updating these lists on a regular basis. I think that's what people are looking for. Let me just keep going. Here we go. So I'm trying to read some of the shorter questions because some of them explain things in great detail, which is helpful if I had time to read them all. So here we go. Right, one from my home country of Ireland, my home island of Ireland, from Kieran. Ireland would like, first of all, to acknowledge all the efforts of the Ukrainian health system in this conflict. We're very proud, obviously, of the work and the resilience of your health system in this terrible situation. Ireland is supporting Ukrainians through the offer of medical evacuations and access to our health system to arriving refugees. Could the Minister talk about how we could exchange now and in the future the clinical notes of patients who receive treatment? We have patients who need cancer and other treatments, and it is very helpful if we could know what treatments they were already on. Is that something you could respond to, Minister? Because I know it's a question I've received from many people.
Yeah, about medical evacuation, yes.
Yes, it's more to do with people. I mean, if someone is evacuated from Ukraine and we aren't able to access those medical records, the people in the receiving country have to start from scratch almost and say, what is wrong with you? I'm just wondering, is there any way of digitally, sorry, please carry on.
There are different options actually possible. If the patient was evacuated through the Ministry of Health pathway, we are provided, and Ukrainian clinic provided all package of documents. If not, and it was emergency evacuation and document were lost, we're trying to grab this information from our electronic system. It's not always also possible because some regions are occupied without access to the medical records. So if it's possible, we're doing our best to provide this information. But sometimes you should understand it's impossible because the hospitals destroyed with all medical records. Yeah, as I said, 38 hospitals fully destroyed. There are nothing exists anymore.
So perhaps to Kieran in Ireland, again, perhaps the quickest route for this would be to send a very short email to the Minister outlining what it is you need. And I know from listening to him at the moment, he and his team will do their best to answer as clearly as they possibly can. So do feel you've got a direct contact now in Ukraine. I see there's yes, here we are. Another question from, I think it's Androkaitis. My question is about healthcare workforce shortages. Do you have some list of healthcare workforce which you require to recruit from foreign countries? I assume, Minister, you're getting quite a number of volunteers at the moment who are willing to step in. Do you want to say something about your needs in workforce areas before we move on to the next 2 questions?
Yeah, around, actually, I can check right now, but more than 400 medical professionals joined as volunteer to the Ukraine. And we got more than 2,000 requests or propositions to join. So I would say for now, and what you should understand about Ukrainian health system. Before the war, we had highest number of healthcare facilities and one of the biggest number of doctors per population. Actually, that's why we are our system exists and provides services because we are have enough resources. But why it's important for us to bring volunteers from the other countries? Because our Ukrainian doctors need some rest. You know, they are working 24/7 for a big period of time, and to have some rest, they need one or 2 weeks. That's why we are bringing in other teams and changing a little bit to allow them this. So there are no critical needs for external staff, but it's always welcome if someone wants to join and support Ukraine.
So again, I think, again, a very clear answer. Thank you very much indeed, Minister, for being so clear. If you've got, we're also looking at workforce. We have a number of countries, particularly the surrounding countries, who have been great at accepting refugees, but also keen now to get people into Ukraine to assist where necessary, but it needs to be well organized. And so again, if you've got a specific proposal, please send it directly to the minister so he can consider that in the round, because you can imagine lots of things are happening. The second part of the question, just to come back to it, if I may, was the question of one that keeps coming up, and I must say I'm trying to bring together about 10 of the questions, all of which have got the similar theme, and that is this. In terms of digital health, are there any specifics that are not on your list, Minister, at the moment that you think may be of assistance to you? Because a lot of the people on this call are either IT companies or health systems around Europe and elsewhere who already use digital tools every day. And if there was some, maybe in the next update, if there was any request for telehealth equipment, and I know there's some telehealth suppliers on the call as well, would it be possible to think about that and include that in the next update? Because a lot of people would like to help.
Yes. Actually, we have a big component of e-health system, including telemedicine. And we have another deputy minister who are responsible specifically for digitalization. And it will be good to have specific meeting on the digitalization, because the plan before the war, we had a so big a comprehensive plan on e-health development that it will be required a couple of hours just to present everything. Right. A lot of things are still very important and need to be implemented as soon as possible. So I guess another specific meeting on digitalization would be good options.
Well, we'd be happy to organize that as the Ukraine Health Connector. Andy in particular, who's our communities director. Could I ask everyone who has asked questions on that particular topic to maybe drop us a line as well, just to tell us what you're offering. We will then work with the minister and his colleague who specifically looks after e-health. We will have some initial meetings, and then we will organize another public meeting like this so we can address this. I know many of you, in fact, I've talked directly to some of you in advance of this meeting. I know many of you actually have equipment, have processes and tools which you'd like to bring into Ukraine and connect them to other countries. So we will, as the ECHAlliance, take up that challenge. There was one which is very clear and specific, and that is from Claire, who says, is there a specific channel for financial donations? Do you want to take that one, Minister?
Yes, we have specific. We defined Ukraine Red Cross as an organization who are accepting money donation for Ukrainian health need, and we have decided where this money will to go. I will share with you a link, and if someone to
pick
make
it
a
up.
donation, please go to this link, and you can
do so. So Heather and if you could pick that up so that we can distribute it later with the recording and so on as well. Brilliant. So while all that's happening, let's go back, if we can keep going, because there's still 40-something questions to be answered. Apologies if I don't get to all of you, but I'm doing what I can. Here we go. Next one was on the question of, I'm just looking down, we've answered that. Yeah, there is a question here from Spain, from Jose Juan. He's a partner of Generations for Health. He obviously expresses, as we do, that we all stand with the people of Ukraine. The next one was, he is very keen to understand what he can do to help, particularly in the area where, obviously at the moment, there are lots of people with mental health issues, depression, and it's not surprising, etc. You have probably some quite good services existing in Ukraine, I imagine, Minister. But I think the question, it goes on for 3 paragraphs, so I won't read it all. But I think what people are actually saying is, can they help in some way? So maybe in the next update, we could also address that. It's another way of connecting tools to assist people. But I'm imagining I remember looking at your plan, the big plan you talked about before the war. And indeed, we as the Alliance were in the middle of setting up one of our ecosystems in Ukraine. And we still want to do that because we want Ukraine to stay connected to the rest of the world, obviously. But we'll talk about that separately. But in that, there were plans about mental health and so on. Do you want to comment just generally on how you're helping people, not just physically, but obviously mentally as well, Minister?
Yeah, mental health is a big challenge for us. And first of all, we opened the hotline where the doctors can consult people. But again, it's not enough. And on mental health, actually now we are trying to develop strategic how to manage this huge problem, because the resources for mental health is not enough in Ukraine. Right. And there are not enough professionals and medicines. So it will be like next big challenge. Now, as I said, we are focusing on saving life strategy, yes, and that's our key focus. But mental health, it's a issue that if your partners, participants have a good experience and they want to share an idea how to deal with it, we are welcome and all opportunity, because it will be very critical soon.
Thank you very much. I thought that would be, and just on that, as everyone will know, perhaps just to inform you, Minister, we within the Alliance already have an ecosystem on mental health, which is a cross-border gathering of experts from across Europe and indeed now into other countries as well. So Andy, if you could pick up on that, particularly when we have the conversation with the Minister's colleague on our next webinar, focusing on digital as well, then I'm sure we can, and many people listening can contribute real actions on that. Just to keep going, another question was, you may not want to answer this directly. You had talked about the number of hospitals which have been attacked. It says, the question is, can you explain in more detail in which regions healthcare infrastructure is more destroyed? You had said earlier you're conscious of not giving too many details, but perhaps you could respond to the infrastructure question.
Of course, the most destroyed is where occupied territory. When Russia comes, they destroyed everything. Whatever, it's social infrastructure. It's the same. It's the situation not only with the hospitals, it's the same with the schools or kindergarten. For example, in Lugansk Oblast, there are no clinics left. In hospitals and ambulatories, there are no left that are not damaged or fully destroyed. So Lugansk, Donetsk Oblast, Zaporizhzhia, the infrastructure is critically damaged, and because the big territory occupied, we really don't have access how to bring the mobile hospital in this area. Now it's physically impossible.
Right. Okay. Next question I have is, and we've touched on this already, and a number of you have asked similar questions. So let me say again, we will speak to the Minister and his colleague, particularly about digital and e-health quite as soon as possible. We will then organise a further webinar, which I hope you'll all attend, and we will have those people available to you to talk about specifically what can we as a community do to assist on the digital tools, because I think we need to reread the original e-health strategy for Ukraine, and we need to obviously adjust it. But there may be some specifics and urgent things we could do, as we're trying to do on the humanitarian front as well, which may be of help. So if I could leave that for the moment. So the answer is, another question is that if a donation, so what people are saying is, if they get a request from a particular hospital within Ukraine, should they respond to that directly, or should they check it out, so to speak, with you and your team, Minister?
Yeah, as I asked, please verify this request. Yes, it's very important. With this verification, we avoid duplication. And sometimes we verify what specific request. Maybe we procured or will procure it in a week and delivers medicine. So if you can, please verify with me or with Alexandra Kozlovska.
Please, so the contact details are there. Another question along similar lines is that George Crooks from Scotland has asked a question. He said, I fully recognise the significant challenges around hospitals and clinics. Can I ask what the situation is with primary care provision, and if there are any major challenges that we could assist with? Primary care, Minister.
Yes. Generally, in health system in Ukraine, primary health care, it's not a big part of health system. Most of concentrated in Kiev region or Kiev Oblast, and that's why some big hospitals around the Kiev was destroyed and now not functioned, and they moved to the other regions where they can work as for now. So again, generally, it's not because the private health care is quite limited. It's not damaged. We cannot compare public and private damages. Yes, but it's only just because it's all most of those was concentrated in big cities.
Right. Okay, I'm grateful to Flaviana from Romania, who has given us a number of, in the question and answer session. We will be copying these and making sure they're available to everyone if we don't get through all. But Flaviana, thank you, because she said, for example, in Romania, there already exists a telemedicine solution for mental health in Ukrainian language. So that's the sort of thing, Minister, I think you'd be interested in. And I will have Flaviana. Flaviana, I'm sure you will write direct to the Minister after this call. Because I know that you're very keen to help, and the fact that it's in Ukrainian as well would be exceptionally helpful to us. Right, the next one then that I have is, there's some people asking what happened to money already donated to the Red Cross in the UK. I'm not sure the Minister, I'll put that to the Minister. I mean, a lot of people did raise significant sums of money to the Disaster Emergency Committee, talking about the UK in particular. And I know many countries around the world, and many of you who are listening, have raised significant sums of money. But I think that I can't imagine the Minister would want to, or be able to tell you even what sums have been received and where they have been used, because that would require quite a lot. you want to comment at all on funds generally, Minister?
When you donated Red Cross, for example, they're spending money, International Red Cross, yes. They are spending money not only for the medicine, it's covered other humanitarian issue. And they reporting to government of Ukraine. I haven't seen the last data, so I don't want to confuse anyone. But they reporting to the government. We established National Humanitarian Council, and this council are working closely with all big international organizations.
Right, thank you. I'm just looking again, there's still questions coming in. Yeah, here's one, which I think is worth just touching on because it covers a lot of the similar questions. There are quite a few patient groups or organizations who represent not-for-profit patient groups around the world, and they want to know how they can help. And I think if I may try to answer that, you can, obviously write to the Minister, but also feel free to write to us at the Alliance, because we are trying to coordinate as much of this as possible. And it may be easier if you connect with us. We can analyze those and then put them together and present them to the Minister, rather than, him receiving hundreds or maybe thousands of emails. So if you can send those to us, we will coordinate that and present you, Minister, with a follow-up to this webinar. Would that be easier for you?
Yes, it's a right strategy.
Right.
Because you can imagine it's sometimes impossible to respond everyone if hundreds and thousands people will.
Correct.
Let's consolidate resources.
Yes, we will do so. The next one is from Marius in Bucharest. He says, let me just read this out as it is. Do you expect from the EC and HADIA to continue the prioritization of EU funding, i.e., for example, EU for Health, Horizon Europe, etc., for Ukraine and neighboring countries? I know that Ukraine have asked to become members of, I don't want to get into politics, but I understand that Ukraine have applied for membership of the European Union. How does that impact on the many funds that are available within Europe, and can Ukraine benefit from those?
First of all, now we are in process to be part of EU. Yeah, we are filling, it's bureaucratic procedure with filling questionnaires. Most of your countries pass this procedure before. But now, even before we are joining the EU, European Commission and other European organizations support us with providing easily access to the medicine and some medical equipment. They open some actually, it's quite hard to explain in English for me because it's a bureaucratic issue. But they are supporting us with the medicine, and on a country level, when they see our request, and each country brings the resources that they are available to the Polish and Polish RARS. Its special agency, they deliver it to Ukraine. So we are in a good connection with the EU, and as a Ukraine-EU relationship. But in parallel, we establish bilateral relations with all European countries and work in these two parallel ways.
Right, got you. I think that many of us on this call, many of the people on this call are used to applying for European grants and so on through Horizon Europe, Digital Europe, and the most recent one is the Recovery and Resilience Fund, for example. And there are countries in some cases who are not yet in the EU who can actually be partners in that application. So I think that's maybe something, Andy, you could make a note. We could examine the legal situation and what's possible, particularly in advance of our next webinar. Right, the next one I've got just to complete. I know I've got to watch the time, of course, but here we go. There's an interesting one here from a lady, Lorna, who says, I appreciate the focus at the moment is on medicines and medical supplies, but as a physiotherapist, is there anything we can do to support your rehabilitation staff in Ukraine? And we've got a number of people here actually saying they would like to volunteer to assist in Ukraine. So I guess go back to your original answer, Minister, that you have a process if you wanted volunteers or support. And so we could maybe get those details from you and put them up on our connector for anyone who wants to volunteer, whether it's physiotherapists, doctors, nurses, or carers. Yeah?
Yes, and give me 1 minute.
Sure.
I will try to find on our website the
link.
Actually, all volunteers who want to join, they should fill the form. And I will try to find this form right now and share with you.
Yeah. Well, while you're doing that, if you can, that's great. If not, we'll pick it up from you shortly and we'll put it in our own stuff. I'm just looking down. There's one here from Carolina which says, looking into the future, what do you think could help you, health authorities in Ukraine, to ensure the continuity of care of the people who are now treated abroad, but will come back to Ukraine after the end of the war? What would you suggest to the countries that receive refugees? Now, obviously, there are significant numbers of people who have refugees, but there are a significant number of patients as well who are being hopefully cared for well in other countries. Hopefully, many of them will want to return home. But as you say, the destruction of many of the medical records may well hamper their treatment when they return home to Ukraine. So what can we do about that? Or is that just my imagination?
The best we can do is synchronize electronic records between EU countries and Ukraine. And it's one of the tasks for future. It couldn't be done very quickly, but it's only one strategy to be able to see the whole patient records. And I share in the chat.
Oh, brilliant! That's brilliant.
The link. So if foreign colleagues want to join Ukraine, just fill the form, and guys from our team will contact you. And
that's brilliant. I must say, I'm very impressed with the fact you already have, in this terrible situation, a number of what you and I might call bureaucratic systems, but sometimes you need bureaucracy to make things organized. So I'm sure our listeners and people participating will want to follow that up. So that's the answer to that.
It's not bureaucracy.
Is it not? Okay.
We're trying to actually we are trying to delete as much bureaucracy as possible for now in different ways. But
good for you.
We need one stream where the people could contact and say that wants to join.
Yes, indeed. Just because we're coming towards the end of the time, just to say that I want to just acknowledge that a number of you who we have worked with have been very helpful in your own initiatives and connecting them into our Ukraine Health Connector. We've been amplifying your messages. And the good thing about this is many of them are very specific, which is what I like, where people are actually taking action. We all hear of the horrible things. We watch it every hour on the news. It's all very well to say, as I said in one of my podcasts, it's all very well to say that's terrible. But the question is not that. The question is, so what are you going to do about it? The usual answer, I'm afraid, for many people is, what can I do? So we're now giving you answers today, and we'll keep pushing this out to everyone. There are things we can do. As we are doing in the Alliance, we are known as the connector. Why wouldn't we connect our global community to assist Ukraine? So don't give up. Some of you think there's not much you can do. Look at what you're already doing and try to translate that into assistance directly to Ukraine. One shout out, if that's the right word, to a small charity in West Wales, which I know of, which has sent me a note to say they're very proud of having donated medical supplies to Ukraine through a council, a local councillor, organised this collection and delivering that medication. So those individual efforts may be small in some ways, but actually I'm sure the Minister would agree, this is precisely the sort of global effort we need to continue to supply Ukraine with what it needs. I'm sure you'd be happy to thank those people in Wales in this case and many other places who are trying to continue to help Ukraine. So there are more questions, but I know, and apologies, I'm not able to answer all of them, even in writing. I think we've covered the bulk of them. I know some of you were saying, well, why did you answer this specific one? Well, we have copied all the questions. We will be directly in touch with you. We will consolidate some of them and send them to the Minister and his colleagues. And then you'll hear more from us on that. I'm just looking at the last questions that come in to see if there's any more. Oh, yeah. No, I think we've covered as much as we can cover. We will, as the Alliance then, if I could just indulge just for a moment. Andy, could you put up on the screen, it would help the Minister as well to understand the way the Health Connector has been working, and maybe some of our listeners as well, and what we're doing to try to coordinate efforts, please.
Yeah. Just so you can, I've made references into the chat function for people who wanted to come forward with initiatives. We've already established, because of what Brian was saying, this idea of where we can amplify existing initiatives. So we can give that coverage. So we don't want to keep, 20 different initiatives doing the same thing. So we've created the Ukraine Health Connector. This is where we amplify those initiatives and the needs. So you see the list of medical supplies needed listed there, as well as some very, very innovative input from not just our members, but our ecosystems too. So we've got input there from colleagues from Moldova, from Romania, but also from Lithuania and colleagues close to the border, who are on the receiving end, obviously of refugees, but also tasked with some of the health tech challenges as well. So we've seen some great initiatives on there, such as the Health Tech Without Borders. We've seen the support in terms of employing people directly who've come from Romania, have come from Ukraine to places like Romania. But you can see there a number of initiatives. Please email me directly using the andy@echalliance.com email below, because I think what we can do is, as Brian said, is amplify those existing initiatives where we can, both needs and solutions. So there's some of these that come from our ecosystems themselves. We've already said, we're engaged with some of these activities. We want to be able to share both our resources with people coming in from Ukraine, support we're doing, such as in countries like Moldova and Romania, that Flavian has referred to. We've got a number of ecosystems that are, very, very close to and have got long historical ties with Ukraine. You can see that with our network here. So what we want to be able to do now is, we've heard from the Ministry, we need to think about where we can add value, patch in some more of those inputs from our ecosystems and our members, and try and add value and keep that connecting role that we can do going, because the more initiatives we get from you, the better we're able to amplify them. So use the link and the email address in the chat function below to contact me with those initiatives, and we'll make sure that they get amplified via our Ukraine Health Connector.
Thanks very much, Andy. Minister, we're just have a few minutes left. I just leave you perhaps to make a closing statement, if you wish, just to say to people, and thank you. We really appreciate you being here.
Thank you, team. Brian, for organizing this event. Thank you for all participants for your support. Let's stand with Ukraine, and hopefully the war will finish sooner.
I hope so. We all hope so, Minister. And we all stand with Ukraine. And I think on a practical basis, we will now, as I say, gather all those questions, all those answers. We will supply all the info to everyone who's on the call, but also the recording will be available either later today or first thing tomorrow, because I know many of you want to use that to your own communities. And we will come back to you, Minister, to set up the call with your eHealth colleague. And then we will announce, let's call it, for the want of a better word, eHealth webinar next. But let's forget that the humanitarian needs which are listed here are still needed. this is not a one-off. This is something we have to go on working with Ukraine and supplying as much as any of us can do. And don't think you can't do very much. Together we can do a lot. So, Minister, again, I really appreciate your time and your willingness to answer as many questions as possible. Thank you for all those that attended. We will be back in touch very, very soon. So thank you. Thank you, Minister.
Bye-bye.
Bye-bye now.